Do we need to look at depression differently? And is how we see it now, is that enough? I'm not convinced that we do look at it the right way. The autonomic nervous system is, and the sympathetic and parasympathetic are fear, fight, flight, rest, digest, side of the nervous system that governs all of the involuntary actions in our body. This also, of course, links to the central nervous system and the biochemistry. So neurotransmitters, chemicals which are involved in transmitting the information across neuronal synapses from one side to the other side, the presynaptic and postsynaptic cleft. So things like adrenaline, or epinephrine and norepinephrine if you're American, or adrenaline and noradrenaline, serotonin, dopamine. These are nerve transmission chemicals. Now, we know that if we get excitation and sympathetic activation, this will release cortisol, and it will also release adrenaline. It will release epinephrine, and parasympathetic will release noradrenaline, norepinephrine, and dopamine, the more sedative side of the neurochemical responses to the nervous system. The traditional view of depression would be, and schizophrenia, and most health problems, is that there is some deficiency, there is some inevitable, can't do anything about it, born like it thing that means that our biochemistry just is that way. It's an organic thing. Back in the day, we used to describe things as sort of functional or organic. In fact, there's still a lot of people that will do that. I would say that's a functional or an organic disease or disorder. And many of you know that I challenge that paradigm that, of course, there are certain things. If we're born with certain things, we're born with an absent foot, then we're born with an absent foot, and that's the way it is. We can't sort of grow one. However, what if we see that stress, trauma, causes dysregulation in the way that the nervous system responds? Well, is that going to change the biochemistry in the brain? Well, of course it is, because we know that if you stimulate one side of the sympathetic nervous system, you're going to get neurochemical release. Now, we would see that there would be a chemical imbalance in the brain. Yes, that's observable, that can be seen. That's what's led to the challenge of saying, well, okay, well, then we need to just give them a drug to change that. Yes, but what if we went, but why? My famous question is, all right, well, that's there, but why is it there? And what if we view stress in the system, life events, response to our environment as having an influence via the nervous system up into the biochemistry of the brain? Well, this can disturb the clinical presentation of the individual, and that might be depression, it might be anxiety, depending on which chemical imbalances or which chemical dominance is occurring. So change the environment, change, even if that environment was a past event, change how the body responds in the here and now in response to what it learned in the past through neuroplasticity and practice and changing the whole physiology. Change that and you will change the neurotransmitters within the brain. Now, of course, you see there's an emotional presentation. So we talk about emotions and pushing down emotions. Well, what do I mean? Well, how does that relate to this? Well, if we view that dealing with an emotion only when it's not allowed to flow through, to complete, whichever way we want to view it, then it becomes stuck. Of course, it doesn't become stuck, but it becomes an unprocessed, incomplete thing. And that causes disturbance and dysregulation, potentially in the biochemistry. So if we don't allow the emotion to be processed, that is going to mean that it's going to push the nervous system into a particular place which will change the biochemistry in the brain. And so potentially depression or anxiety, depending on how the body is responding. So I hope that this gives some hope to the idea of how we can view depression differently and give a hope for change, and to give a hope for a new paradigm and a new approach to seeing depression as not something which requires antidepressant medication. In fact, if you look at antidepressant medications, most people say, well, yeah, I just feel numb on it. Well, yes, you will, because what they're not doing is they're not actually anti-ing the depression. What they're doing is they're depressing it all. They're just saying, well, you can't feel anything. Oh, great, well, at least I don't feel so miserable. True, but it's actually preventing you from feeling anything. So I'm not saying there's no place for antidepressants, and to cope, that they may be really important for people. And sometimes it's important to work with people where we're using some antidepressants, but maybe with a view to being able to support them to come off those antidepressants in time. But how do we do that? Only by changing the way that their body is responding and reacting. So I hope this gives a different view on maybe what is depression. Hi, I'm Roger. Thanks for watching the video. Hope you enjoyed it. And don't forget to hit the like and subscribe buttons.